Yeah, it's common in teenagers and folks like in their 20s to have their pain from Scheuermann's disease. It's a little bit complicated, but basically the end plates of the vertebral bodies are weakened. And then you get like basically wedge fractures of the vertebral bodies. So what ends up happening is Scheuermann's disease is picked up on X-ray, and instead of them being like this, it's almost like they're caved in. And then when the person bends over, there's a hump. And basically, whenever you have any weakness of a structure, like a disc, like a vertebral body, it puts a strain on all the other structures. So in other words, the vertebral body or the disc, it's not as strong. So by strengthening the ligaments, which prolotherapy is really, really good at strengthening the ligaments, you then again have support in that area. So typically, prolotherapy for Scheuermann's will do a couple segments above where the vertebral body problems are, and a couple segments below, as well as all the vertebrae that are affected with the Scheuermann. So Scheuermann's is typically in the thoracic area or lumbar area, and normally it's 3 or 4 vertebrae are involved. So you might get like half of your thoracic area done, or the whole lower back done with prolotherapy. And normally it's 3 to 6 visits, but typically the prolotherapy is effective at getting rid of the pain, and then athletes get back to all their athletics. I should say though, that hump, I mean the hump is still there because the deficits in the vertebral bodies are still there. But because the ligaments and the other structures that attach to the vertebrae are stronger, you know, the pain goes away, and then the athlete's able to do all their exercises.